Welcome to the Cardiovascular Research Onlife. My name is Konstantinos Stelos from the Newcastle University in the UK. I would like to introduce you Professor Kiran Musunuru from the University of Pennsylvania. Professor Musunuru, in your opinion, what are the most exciting advances in genome editing?
So genome editing, I think, has two potential applications that are very exciting. One is on the research side and one is on the clinical side. So on the research side, it's proving to be very useful for disease modeling, for easily generating, for example, knockout mice much more quickly than we ever have been able to before, making genetically modified organisms of all variety of the types. So we're not just restricted to mouse or the standard model organisms, but can expand to organisms that we've never been able to use before and able to do it in a very efficient way and increasingly model more and more complex diseases. On the clinical side, I think it's very promising because there's the potential to actually treat human disease, to actually use genome editing tools, deliver them into cells that you would then put into the body, or even deliver them into the body itself and actually treat diseases. And if we're talking about cardiovascular diseases, we're talking about things like coronary artery disease in the sense of preventing coronary artery disease, potentially treating cardiomyopathies and disorders of that type.
So in your opinion, as editor-in-chief of Circulation, Genomic and Precision Medicine, which are the future applications of genome editing in precision medicine and especially in cardiovascular medicine?
Yeah, that's a great question. So it's something I think about a lot in my capacity as an editor of a journal focused on genomic and precision medicine, but it's also something I do in my own research, in my own laboratory. And so where I think it's going to prove to be very useful is with the problem of the so-called variant of uncertain significance. So as people in the clinical setting, patients, increasingly are being gene sequenced, exome sequenced, genome sequenced, we're finding many variants in genes that are known to be linked to disease, but the significance of those variants themselves are not so clear because they may never have been seen before in anyone. They may actually be unique to that one patient or that patient's family. And so where I think genome editing is going to prove to be very useful, and it's already starting to happen, is to be able to introduce variants into, for example, stem cells. Take stem cells that now have the variant of uncertain significance of interest, turn them into, for example, cardiomyocytes, heart muscle cells, and then see how they are different from the matched cells that don't have the variant. And so you're comparing apples to apples, and then if you can see differences between them that suggest a link to disease, that's a sign that the variant actually might be pathogenic, might increase the risk of disease for that patient. Whereas if you don't see differences, it's a sign that that variant is benign and has no implications for that patient's future. And once we get this working at a sufficiently large enough scale where we can do this on many variants and perhaps even all possible variants in genes, I think we'll be in much better position to actually be able to interpret someone's genomic information and what it means for their cardiovascular health.
Would you encourage young scientists and clinicians to work on genomic and precision medicine, and why?
I absolutely would, and that's because I think it's the future. I think the whole premise of genomic medicine, precision medicine, they're not exactly the same, but clearly interrelated, is to better treat patients by being able to take advantage of the latest technologies, molecular diagnostics, therapeutics, and really be able to individualize it to particular patients, determine the best ones. And that was going to require a lot of work, but at the same time, it's going to be very exciting work because it utilizes all the latest technologies. It means aggregating all sorts of data that we haven't really been able to access before on all the various omics levels we talk about, not just genomics, but proteomics and metabolomics and phenomics and microbiomics, and just add all the omics that you want. And then we're really going to need smart people to figure out what to do with all of that big data, as we call it. How do you combine it? How do you analyze it? How do you make sense of it? And then how do you discern patterns in that data that will then allow you to figure out the best way to manage a particular patient at a particular time in her life?
Professor Musunuru, thank you very much for joining us today.
My pleasure.
And thank you all for watching this interview.